Hello all, this is Dr. Shilpi Reddy, Clinical Director, KIMS Cuddles Mother and Child Center, Kondapur, Hyderabad. Today we're going to discuss some symptoms and signs of inflammatory breast cancer. Inflammatory breast cancer is called as IBC, and there are certain specific symptoms and signs of inflammatory breast cancer that I want to discuss today. Any redness or swelling or itchy breast that is tender to touch has to be observed. The surface of the breast may be taken on a rigid or pitted appearance or similar to an orange peel appearance. Almost all, sometimes they call it as pudy orange. That is, it feels like an orange peel. And if there is any heaviness, there's burning or aching in one breast, and one breast that is visibly larger than the other, and an inverted nipple facing inwards, or no mass felt within a breast during a self breast examination, but there is this kind of a redness and swelling, and there are swollen lymph nodes under the arm or above the collarbone, and symptoms are not resolved even after courses of antibiotics. Unlike the normal breast cancers, inflammatory breast cancers usually do not cause a distinct lump that is seen in the breast. Therefore, a self breast examination or a clinical breast examination, or at times even a mammography, may not detect inflammatory breast cancers. So, ultrasounds also may miss inflammatory breast cancers. However, the changes that look to the surface of the breast that are caused by inflammation can be seen with the naked eye. That is why whenever these kind of symptoms and signs are there, you need to be watchful. And symptoms of inflammatory breast disease can develop very rapidly also, and the disease can progress very quickly. So any sudden changes in texture or appearance of the breast should be reported to the doctor as soon as possible, and make sure that you do not watch over or neglect these symptoms and signs. For pregnant, especially who are for women who are especially pregnant or breastfeeding, redness and swelling can depict, it can have itchiness or soreness or even slight breast infection can also be there, which is called as mastitis, which is treatable actually, and which comes under control with antibiotics. And if you're not pregnant and nursing and you develop these symptoms, your doctor should test for inflammatory breast cancer, which is a very must and should diagnosis that has to be checked in and looked in for, because the aggressive nature of inflammatory breast cancer knows it is critical to detect and diagnose the disease quickly, and develop a comprehensive treatment plan around the diagnosis, and provide integrative care services that really help improve patients' treatment and outcomes. And it is very important not to miss IBC, because to decrease the side effect rates also. As early as you diagnose the symptoms and signs, the treatment modalities also would change. That is why we developed the CTCA inflammatory breast cancer. There's a breast cancer program where breast experts work quickly and properly to diagnose these kind of problems and stage the breast problem as early as possible. And experts collaborate to give the best of treatments possible. And the earlier that you diagnose these problems, the easier the therapy will be. If you believe that you may be experiencing symptoms of IBC and you want to look in for evaluation, you should come in for an appointment as soon as possible and get your doubts cleared. If it is only mastitis or an infective etiology, you can be rest assured you will be cured very easily. But if it is IBC, you need to recognize it as early as possible and take the particular treatment as soon as possible.